I'm telling you, it's really critical to have your input on this. I got 14 people I've interviewed. You're 14. I got the National Guard. I got 2 STNAs from St. Francis, 2 nurses from, I forget the other one, forget the other nursing home. And I got nurses from Mercy Hospital, New York City, coroners, English Shook Funeral Home. I got everybody who was first responders for this. And I'm so appreciative of this, John, because I need all different perspectives for this project, you know, and your conversation, your interview will go to an artist, both high school as well as professional artists. And we'll have that unveiling then at the Ritz Theater on May 18th. If you can make it, that'd be great. If not, we can Zoom it.
Sure, of course.
Okay, so when you first heard about the pandemic, what was your first reaction and how'd you hear it?
I heard about it. I was in a class in Columbus, an EMA class in Columbus, and we were watching the news about what was happening in China and Italy. We hadn't had the first U.S. case yet.
So that's like December, January then, right?
That was in January of last year, yeah.
What was the discussion then for the state level as far as what you're going to have to be doing? Was there any preparation like in February or January?
Yeah, well, yes, we were talking about it, and we were asked to trust the information coming out of China, but we weren't asked to trust that. We were weighing whether or not the information we were getting from China was good,
okay,
and how bad it was really going to be, and it wasn't at that point. We weren't looking at it as a pandemic. We were just looking at it, well, this could be a problem, but we don't know yet. Maybe before it gets here, we'll have some sort of resolution. There's no way to tell.
Yeah, and that had to be February before March when the shutdown hit.
Oh, yeah.
Wow.
Last week, I was in another class, and that's when we were watching people coming back on cruises who were sick, et cetera, et cetera. So, and then within that 2 weeks afterwards, it was, that's when it got bad,
So when you first got the news from whoever, governor or however it works, I don't know the protocol. What was your first thing that you had to do? I know you planned for this, because I know you guys have always planned for these kind of things. But what was your first line of action that when you first got the news as far as what you had to do?
I contacted the Seneca County Health District, and luckily I already know the health commissioner very well from my time just here in town and at the radio station. And I contacted her and said, hey, I'm new in this job. I've only been here a year, but what do you need me to do? And we started talking just about every day or every other day to just stay on the same page and figure out how we were going to start, figure out what we needed resource-wise.
Right.
And I started out for resources there at the beginning because there was a run. People, your everyday people saw the run on toilet paper and paper towels and hand sanitizer, and all that stuff was gone for a while. But there was a similar run on rubber gloves and, or rather nitrile gloves and masks. And they realized that pretty quickly that N95s, everybody was going to become familiar with N95s. And we were trying to get any masks we could get. Any kind of gowns, any personal protective equipment we could bring in to have it ready. And we were a couple of months before we had enough before the, let's see, I can't remember if it was April, I think, is when they broke out the first strategic supply.
Okay.
Strategic supply and sent us some stuff. But I remember that first shipment that I got, I broke it down into equal amounts and took it around to all our nursing homes and to the hospital and to the fire departments. And everybody got one box of 20 masks and one box of 100 gloves. That was it, and that exhausted our supply.
Wow.
And we didn't know when we were going to get more.
Wow, that had to create some anxiety, I would think.
Yeah, well, and I mean, you don't have it, you don't have it. It's not like we're hoarding it.
Right.
So there for the first month, that's the way it went. Every little bit we got in, and boy, did we have great support from the community. I mean, the colleges, as they shut down, the colleges showed up with all of their supplies that they weren't going to use that year, and then the people just brought stuff over from their house. They went through their house and said, "I have a box of nitro gloves, and I've got this box of N95s I bought at Lowe's back last year," and they just started dropping that off, and we got it out as quick as possible.
Wow, that's fantastic. The official, I mean, what was because I have no idea how this procedure works, but you got official stuff from Columbus to say you have to implement this, this, and this, or was it guidelines from the CDC, or how did the word come down for what you had to do?
Well, we didn't really, the only guidelines that came down about how to handle this came from a grant standpoint, or how to fill out the paperwork in order to get a request for information through the state about getting testing. If somebody said we need, the hospital says we're out of tests and we need tests, they would fill out an Ohio RR 213, which is a form that I submitted through the EOC at the state, and they would get their resources on it, trying to buy what we needed from wherever they could find it. And that was their job. And then when they solved that problem, they called me up and said, "It's on its way, or you can pick it up, or this is where you can find it, or here's our solution to this problem." And then we just implement that solution. Meanwhile, at the same time, of course, we're looking locally, and the EMA's job in situations like this is to start pulling people together and thinking out of the box, outside the box, to figure out how we can solve this, or this. So I started reaching out at that point to veterinarians and dentists' offices and things like that I knew had been shut down. And they were sitting on their own supply of PPE. And what they would do is they had the option of filling out a piece of paper that allowed us to replace what we took from them later on at no cost to them, or they could just make it a donation. And everybody made it a donation. Nobody asked for a place. However, when I did get a call in the summer from a pediatric dentist who had an emergency that they had to handle, but they didn't have any PPE, we got them the masks and gloves they needed, because they were, first of all, it's an emergency, and secondly, they helped us out when we asked for their help a couple months earlier.
Did you hear about the other counties too, and they had similar situations, or were any counties that I'm sure you had communication with other county safety officers and so on? Was everybody kind of following the same set of rules for that, or?
Everybody was in the same boat. They were all following the same rules, and we started immediately. We started 3 times a week. Well, this started pretty early. 3 times a week, I have a conference call with other people in my sector, the other EMA directors in my sector, and right after that, that's at noon, and at 1 o'clock, we have a conference call with all the EMA directors and the Ohio EMA, as they give us updates of what's going on from their end. That went on 3 times a week until the end of last summer, where they changed it to 2 times a week when the governor switched his press conferences Tuesdays and Thursdays. Okay. And we all switched ours over to that so that we could discuss what he was about to say if we had that information, or it gave an opportunity for all the EMA directors to talk to each other and ask questions of our leadership, and then they would ask those questions up the chain through the state government.
Well, I tell you, you guys did a great job. I talked with St. Francis and Good Shepherd, those 2 nursing homes, and they did a great job up until November. And I didn't know this, how bad it was in November with them. Did you hear about the issues that they had in November with all the cases they had in the nursing homes?
Yes, yeah, I was aware of the number of cases in the nursing homes. It really exploded there. And we knew that. We knew that was coming. The EMA directors in my sector last August looked forward, because we were starting to see a drop in numbers. And we looked at it and said, we're 6 months into this, 5-6 months into this, people are already starting to, they're starting to burn out on the protocols that they've got to follow, right? Yeah. They're burning out to wear masks. They're burning out on not getting to see their family. They're going to start doing it anyway, and that's going to lead to an increase in numbers in October and November, which is exactly what happened. So that sort of hive mind that we had with all the EMA directors predicted. And so what we did in August, September, and October is when people stopped asking us for gear, we started stockpiling it, knowing that we were going to need it in November and December. And sure enough, that's what happened.
Yeah, did that happen across the state? It seems like it did. I mean, I've talked to different counties.
Well, that's when the state went totally red, and
Yeah.
some counties went purple on that map that they put out. Prior to that, I mean, Seneca County didn't go red till very, very late in the year, but when it did, it stayed there. And we're pretty close to coming out of that red situation. Although nowadays, I don't think the colors matter as much as except that it shows progress and shows a little bit of hope going forward.
Yeah, we haven't gone purple, which is good.
Yeah, right.
Yeah, I know the number of cases, it seemed like it stayed pretty constant, you know, below 50 there for the first 2 or 3 months.
Yeah, yep. It was, and it was a big deal when we had our first death in the county. Last July, I think, is when we recorded our first county death, and there was a press release, and we had a press conference about it, and it was a big deal because I think everybody at that point said, we're rural. We don't have the same influx of people and crossing through, and we're not a big city, and we're probably not gonna see very much from this. It's much ado about nothing. But right after that first death, how serious it was really set in.
What concern did the county have with the schools coming back, Heidelberg and Tiffin coming back into session? I tell you why, because I heard it from townspeople that, you know, that these universities are going to infect the whole town because they're coming back from all across the country.
Well, you know, I didn't share that. I was not concerned about that. Heidelberg and Tiffin University, they have as much to lose by being irresponsible by just bringing people back as anybody else. And they weren't going to do that without knowing that they had the proper controls in place. They're the least I was worried about. Yes, and your general townspeople, all they saw was Heidelberg's opening up. Tiffin University will be bringing back students, but that didn't mean that they were going to do it irresponsibly. That didn't mean that it wasn't going to be with some sort of control that followed CDC guidelines. So I personally wasn't worried about it, and that's what I told people, is that they've got their own controls in place, and they need to, you know, it's an easy target for people who are nervous anyway,
right,
and don't have anywhere to put those feelings. So,
right, and that's what I kept hearing all summer, because I was here all summer, and so when we only had, I think we had 50 cases that they had to go to the hospital out of 2,000 students, and I thought that was a pretty good percentage from our case, which I felt good about. What were some of the worst case scenarios that you had to plan for?
We had to, and we tried to keep this under the radar because we didn't want to cause panic, but we looked far enough ahead to be prepared for mass fatality, overrunning our capacity for morgue space. So we were prepared with refrigerated units on standby to handle more dead than we could, than our current capacity could handle.
Yeah, Stark County had that. I know that. I talked to the coroner in Stark County and also in Licking County. Stark County had to use those. They had the refrigerated units in their parking lot.
Yeah. We had planned for that. We had those on standby. We knew where we were going to get them and how quick we could get them in. And that was worked out with Mercy Hospital because that's where that process starts, at the hospital.
Right.
And luckily we didn't have to use it.
You know, I was talking with Eric at Ingalls Shook, and they did 37 funerals in a month in November. And that was just crazy. I mean, I can't imagine the kind of, I mean, they're experts at grief. I know that. But grief on a mass production scale has got to be challenging to them. And these are the things that, you know, I didn't know about until I started this project. And so I'm glad that you guys had that plan in place, because, you know, as a civilian, we don't see that, and we react to what we see. As you know, I also do the same thing. Like, well, I don't hear anything. I'm not involved in it. I don't see anything. And then I heard about what happened in November, and that had to be kind of had to create some anxiety, I would think, when you heard all the cases in November coming up in December. Did that cause any issues with you guys, as far as, you know, you had it on your radar, I know?
Yeah, that's when we revisited and made sure that our systems were still in place and ready to go, and had more conversations with the hospital and how we were going to handle it, what needed to be done. So we revisited that to make sure, because, you know, November and December and January, that's already a big funeral. I mean, if you look at just the year, that's when you see uptick in funerals and in a particular area. And so to add a pandemic on top of it, our already weakened population, we saw that that might be an issue. And luckily we slid in underneath that. The funeral home stepped up and they were able to manage. They didn't have to reach out for any extra help. I hope they knew that the help was there. I tried to get that information out to them. But that mainly came through through Mercy Hospital.
Last question for you, John, 'cause I don't want to keep you. When someone looks at your artwork and they see what's been created, what would you like them to walk away with? What image, what feeling, what would you like you to have them walk away with when they see your artwork?
The strength of the community. This could have been so much worse, and not the pandemic itself, not the actual virus, but the response from the community. Lots of people are frustrated, and before they were frustrated, they were scared, and but they really came together where it counted. So.
Well, I'll tell you something. I agree with you on that one, boy. And that's one of the reasons why when we had this event, I called the Chamber of Commerce today, and I said I need to have at least 30 companies with one person representing that company to be at this event, because I want these people to know who work in these industries like yourself to share that, and so people in this town know what you guys went through. And I think it's critical for them to know that we're behind you, and I didn't know it, and I. Not that I live here all the time, but I still didn't realize what was happening in November, December. It was crazy.
Right, and you know, that's one of the things that that's fine with me that people don't know that, because that's what we try to do. If we can take care of an emergency with the least amount of impact on anybody, then that's a win. But that's impossible. There's going to be impact, otherwise it's not an emergency.
Yeah.
So how can we do it without causing
panic,
more stress and strain on top of the rest of it? Yeah.
Well, I tell you what, the town, that's a great point, John. That's a great point. The town didn't panic.
No.
As bad as it was in November and December, we didn't panic. And I think that sets a tone for what kind of people we have in leadership. And I think that's a big part coming from you.
And I'll tell you, I talked to a lot of EMA directors who did not have counties that worked together. And I'm talking about the leadership, and they just had a real struggle this past year. And our leadership in Seneca County has been lockstep in one direction the entire time. It's amazing to see.
Well, you guys did a great job.
It's so much easier.
Because sometimes you don't notice what you don't see. You know, the lack of a negative is hard to recognize sometimes.
Right.
You know, but you're right. You know, we had all this calamity in November, December, and I didn't hear anybody panicking. There's no one, you know, you had things under control. You anticipated it. You know what's going to happen, and we rode it through, and the place didn't go crazy. And that's a big deal.
Yeah.
Well, I'll make sure that we get this message across when I meet the artists on your project. Okay.
Great. Thank you very much.
John, thanks so much for your time. I appreciate it. Thanks for being there, and thanks for keeping us all on the one same page. And you did a great job.
Thank you very much, John.
Thanks, Johnny. See you, bud.
Bye-bye.
Bye-bye.